Morning everybody, happy Wednesday. I'm starting at 10 today, far more civilised hour for sure. Hope you're all well. Have a topic for coffee talk, and that is in relation to a question that came in last night. A very, very wily and observant follower noticed the blanching that happens around the eyebrow during the treatment, and that is got to do with a vasoconstriction, which happens when we are doing our treatment. So the topical anaesthetic that we give you, we use cream. We use another anaesthetic during the treatment, which has got epinephrine in it, and that causes the blood vessels to constrict, and that keeps any bleeding and swelling and bruising at bay. So that makes the work easy for us, but certainly it keeps you comfortable. In fact, most of our clients, we have to wake up at the end of the treatment to say, you're done. So, and then when the treatment is done, then what ends up happening is that white blanching lasts for a bit like at the dentist, you see, only that you can't see it in your gums, but for about 40 minutes afterwards. And when it goes pink, usually we advise you at that point to take your paracetamol or Nurofen if you're not allergic. So that's the reason why. On that note, I just want to reassure all of our clients that no injection is used in giving you a topical anaesthetic. So this is a question that came in yesterday actually. Olive, do you inject the local anaesthetic into the eyebrow area? The answer to that is absolutely no. There are no needles used. The only needles that are used are in the tattoo, and you're sufficiently numb at that point. So when we talk about topical anaesthetic, we talk about numb cream that we give you to take home with you, which is used 40 minutes beforehand. We remove that when you arrive in here, and we give you another topical anaesthetic, which is a bit stronger, something we can't give you to home, or I'd be arrested. And then when the first pass is done, so you usually feel about a 2 out of 10, and when the first pass is done, the next anaesthetic, which is very strong with the epinephrine, is liquid. And that was a very prudent question, actually. I wouldn't have thought of it. So the answer to that question is, do we inject you in the eyebrow area to make the area numb? The answer to that is no. It's all topical. It's in the form of cream and liquid. Okay, I hope that helps. I'm going to pop into the consulting room now because